Hello from Michigan. I'm Megan Spadowski with Team Justice Heals. In 2019, Michigan State University launched a campus-wide survey to evaluate the climate and incidence of relationship violence and sexual misconduct at Michigan State University. Over a quarter of undergraduate women had experienced sexual assault since enrolling at MSU. The Center for Survivors at Michigan State University provides advocacy and holistic healing options for survivors of sexual violence. In 2018, the Center for Survivors received a career change dog from Leader Dogs for the Blind. The Black Lab was named Justice, and the intention was for Justice to support survivors in the office and at police interviews, court, and Title IX meetings. The staff at the center quickly realized that Justice loved supporting survivors, but she was experiencing severe anxiety symptoms. She was afraid to ride in the car, climb the stairs, and ride in the elevator, making her very stressed by the time she arrived at the second floor office. Justice began seeing Dr. Hoffensberger, the veterinary behaviorist at the College of Veterinary Medicine, who diagnosed and treated Justice for anxiety. Following the diagnosis, her job was altered to better suit her needs and strengths. Survivors began noticing changes in her behavior and were surprised to learn that Justice was being treated for anxiety. They are deeply invested in her treatment and overall well-being. Recognizing Justice's impact, we were inspired to seek possibilities to explore alternate treatment options for survivors. This led to exploration of animal-assisted interventions and, more specifically, literature on animal-assisted activities and animal-assisted therapy. While we had two seasoned mental health providers, we soon recognized we did not house the specific competency within our immediate team to carry forward the full scope of what we set out to do. Then the global pandemic hit, and the future of our personal and professional lives were uncertain. MSU students were sent home immediately, which removed access to our survivor population, and shortly thereafter, the entire state of Michigan shut down. With generous support and use of consulting funds through clinical scholars, we decided to use this opportunity to increase our knowledge base and skill set to create a solid foundation in our programming. I enrolled in Oakland University's Center for Human-Animal Interventions to gain specialized training as an animal-assisted therapist. One welfare is a concept akin to One Health that speaks to the mutual benefits of the human-animal bond and animal-assisted interventions. Animal-assisted therapy falls under the umbrella term animal-assisted interventions. However, it's a modality in which a licensed human healthcare professional partners with an animal co-therapist to provide intervention. Historically, the literature regarding animal-assisted therapy has looked at human outcomes. More recently, researchers have also started to look at the animals' experiences as well. As a One Welfare program, our team is looking at the outcomes of both humans and animals, which is novel in the animal-assisted therapy literature. With the goal of ensuring a truly One Welfare model to serve both our survivor and shelter dog populations, the MSU Companion Animal Behavior and Welfare Group developed screening tools and hypothesized that dogs who exhibit high levels of social cognition, are empathetic, and who are non-impulsive will be well-suited and comfortable with animal-assisted therapy. To evaluate the tools, screened dogs will engage in a simulated animal-assisted therapy with volunteer undergraduate students. A pilot project is currently underway to identify successful dyads such that both humans and dogs were comfortable and enjoyed the interactions. Human subjects will report their experiences via pre and post animal-assisted therapy surveys. Dogs' experiences will be reported via salivary cortisol and heart rate variability. The dog's behaviors will also be documented using the Human-Animal Interaction Scale, which is a validated questionnaire completed by the human volunteers. With the current pilot data, Dr. Hoffensberger and the dog team will screen shelter dogs for suitability to participate in animal-assisted therapy programming with survivors. This will take place at the community collaboration partner, Ingham County Animal Control Shelter, using knowledge gained in the Human-Animal Intervention Certificate Program. A 6-week curriculum was developed in coordination with the dog team, so each session is helpful and supportive to each survivor dog pair. We'll continue to track both canine and human experiences, and we're considering a skills-based evaluation model to assess the impact on survivors. Finally, we look forward to enhancing our social media presence increasing engagement with stakeholders, identifying sustainability strategies, as well as potential for replication.